Hi everyone, I'm Jillian Andrews. Dry eye disease can be uncomfortable and cause frustrating symptoms. The Dry Eye Treatment Center of Connecticut at Higgins Brothers Vision Care specializes in helping patients find relief. Here to tell us more is Dr. Donald Higgins. Welcome, thanks for being here.
Thanks for having me.
So tell me about some of the symptoms that dry eye causes.
Some of the symptoms of dry eye disease will be a sandy, gritty, foreign body sensation, blurred vision, because the first optical surface of the eye is the tear film, and if the tear film is not stable, not supported by the oils that are produced by these glands called meibomian glands, then it's kind of like having faulty windshield wipers. Your vision will be blurry. It'll clear up in between blinks, but it'll be blurry.
Yeah, and at your treatment center, you have a lot of therapies to help people ease their symptoms, specifically IPL. Can you explain what that is and how that can help?
We're really fortunate that technology has really taken off in this space, and one of my favorites, I've been in practice 43 years, and intense pulse light therapy has been transformational. I've never had a piece of equipment that delivers, so well as this does. And what it does is it targets the inflammation in the eyelids, gets these very important little glands in the eyelids called meibomian glands producing oil. And that oil protects the tear. It's the first surface of the ocular surface. It's just phenomenal what intense pulse light therapy can do. It's transformational.
Yeah, and what does the treatment process look like? Is this a one-time thing, or are people coming in for multiple rounds?
Yeah, that's a very good question. So initially, all the studies show that it requires 4 treatments spaced 2 to 3 weeks apart to get a patient back up and running. Typically, by the time a patient has gotten to us, they've had symptoms for years, have ignored them. So I always tell my patients, you didn't get there overnight. It's going to take a little while to get you better. We space these treatments 2 to 3 weeks apart, and then we bring them tremendous symptomatic relief. The reason why eye drops don't work is they don't impact these glands that are just so important. And the way the intense pulse light therapy works is it re-stimulates these glands, getting rid of the inflammation, brings them back to life. But you asked a good point, and how often do you have to have it done? Everyone is different, and my philosophy is I'm a minimalist. I don't do anything more than I need to do, but there again, I'm going to do everything I need to do to get you better. So we start with those first 4 treatments, and the pressures that put you there in the first place are never going to completely go away. They could be rosacea, they could be too much computer use, so you will require some maintenance. Could be 6 months, 12 months, 18 months. But these patients, because they feel so much better, call us and ask for maintenance programs.
All right, wonderful. Anything else you think is important to add, and where can people get connected with you?
Yeah, our office is Dry Eye Treatment Center of Connecticut. We're in Plainville, Connecticut. And the one thing I always want to stress, there's always something that can be done for our patients. If you have knowledge of all the technologies and all the current medications out there, we can always make people better.
All right, wonderful. And we'll have all that information linked to our website, WTNH.com. For CT Buzz, I'm Jillian Andrews.